Hi friends, once again welcome back to the Nurse channel. So whoever returned the previous AIMS and OSET examination will come to know that the pattern of nursing competitive examinations have changed a lot. So earlier times we used to get very simple direct nursing related questions, but nowadays the pattern of examinations have improved a lot so that we are getting very tough questions. Okay, the competition have improved a lot and the competition is very tight. So all these things are throwing light on the fact that the preparation for the upcoming nursing officer examination should be very effective, so that you have to prepare very well. So keeping all these things in mind, we are in the route to prepare you very well for the upcoming AIMS upcoming examinations like the Kerala PSC examination, and recently a notification, a circular has come regarding the Madurai AIMS. So very shortly we will get the notification also. So keeping all these upcoming examinations in mind, I welcome you all to our new series, and this series also contains nearly 15 very important questions that we have taken from different aspects of nursing subjects, and these questions will definitely help you to equip well for the upcoming examinations, nursing competitive examinations. So once again welcome you all back to our channel, and I request everyone who are watching this video to watch the videos till the end, because the explanations for each and every questions is very important. And I request everyone who are not yet subscribed our channel, kindly subscribe and support us, and kindly enable the bell button so that you will be notified whenever we are uploading the new videos. So straight away, without losing time, we will move on to the next new series, new session. So this is a new session with 15 important nursing questions. So let's see the questions. Here comes the first question in this session, and we have the first question from nursing education, and the question for you is, which is the knowledge-based domain in Bloom's taxonomy? So knowledge-based domain in Bloom's taxonomy. So the options are option number A, cognitive domain, option number B, affective domain, option number C, psychomotor domain, and option number D, perception domain. So before answering this question, you should know what is Bloom's taxonomy and what are its domains. There are 3 domains. So we will see in detail about the Bloom's taxonomy and its domain. Before that, the answer for this question is option number A, that is cognitive domain. Okay, so what is Bloom's taxonomy? So Bloom's taxonomy, it is a set of 3 hierarchical models which are used for the classification of educational learning objectives into levels of complexity and specificity. So the 3 lists cover the learning objectives in cognitive, then the affective and psychomotor domain. So there are 3 domains. That is a cognitive domain, which is the learning based objective, then affective and psychomotor. So what is the affective domain? This affective domain deals with emotions, feelings, etc., and psychomotor domains deals with action. That is the action based domain is the psychomotor domain. Okay, so with this question you are getting some information regarding what is Bloom's taxonomy, what are its 3 domains, and what all things are dealing with these 3 domains. Okay, so that's all regarding the first question. Now we can move on to the second question. So this question is from the cardiology, a basic simple question. So the question is, the study of the pulse is known as dash. Study of pulse. So the options are option number A, sphygmology, option number B, cardiology, option number C, adenology, and option number D, pedology. I can pronounce it as pedology. Okay, so the study of the pulse. So the answer is option number A, that is sphygmology. Okay, so this question is slightly confusing. So we will see the options first. The procedure of pulse palpation is termed as the sphygmology. Okay, so the procedure of pulse palpation is termed as sphygmology, and literally meaning the study of the pulse. So study of the pulse, sphygmology. So the other options, cardiology, it is a medical specialty dealing with the diagnosis and treatment of diseases and abnormalities involving the heart and blood vessels, that you know very well. Then what is adenology? So it is the branch of medicine which deals with the development, structure, function and diseases of glands. Okay, adenology, study of glands. And the final option was the pedology. So I have given 2 pedologies here. One is the pedology and another one is the pedology. So pedology, it is defined as the science that studies the genesis, nature, distribution and use potentially of soil resources. Okay, soil resources is the pedology. And what is pedology? So it is a study of the character, growth and development of children. Okay, so don't confuse it between pedology and pedology. Okay, pedology deals with soil resources and pedology related to pediatrics. Okay, so that's all regarding the second question. I think you gained some information regarding some terms. Now we can move on to the third question in this session. So the question is regarding the carbon monoxide poisoning. So which findings in the organs reveal carbon monoxide poisoning? Which findings in the organs reveal carbon monoxide poisoning? So the options are option number A, bluish airways, option number B, swollen organs, option number C, greenish spots, and option number D, cherry red and bright pink appearance. So what can be seen in the organs if there is carbon monoxide poisoning? That's the question. So the option number D, cherry red and bright pink appearance, is the answer for this question. So we will have a small explanation regarding this question. So we know that carbon monoxide gas, it is readily absorbed and is unchanged by the lungs. Okay, so after absorption, it largely binds to the hemoglobin. So this carbon monoxide will bind to 90% of the hemoglobin and it cannot be unchanged by the lungs. So the formation of carboxyhemoglobin decreases the oxygen carrying capacity of the blood and it impairs the release of oxygen from the hemoglobin for its utilization in the tissues. So this is what is the pathology, what is happening in the carbon monoxide poisoning. So this can be manifested as a deep red flushed skin color, that is a cherry red color, and it is a one telltale indicator of the carbon monoxide poisoning, and it comes from high levels of carboxyhemoglobin in the blood. Okay, so this is a reason why the cherry red or the flushed skin appearance which can be seen in carbon monoxide poisoning. Okay, so that's all regarding the third question. I think it was very informative. Now we can move on to the fourth question in our series. Question is, which of the following is not a waste treatment method for biomedical waste? Okay, so it's regarding the biomedical waste management, very easy question, and the options are option number A, incineration, option number B, chemical disinfection, option number C, autoclaving, and option number D, sieving. So among these, which is not a method of biomedical waste management? Obviously, answer is option number D, that is sieving. So all other three methods are there in the management of biomedical waste. So sieving, it is a physical method of separation of bigger molecules and it cannot be used in the waste treatment method, whereas incineration, chemical disinfecting, autoclaving, encapsulations are the methods which are used for the waste treatment of biomedical waste. So what is a sieving that you should understand? That is a separation of bigger molecules into smaller one, and that is a sieving process. Okay, so very simple question. So we will move on to the fifth question in the series, again from the cardiovascular system. So the question is, which among the following antihypertensive is the drug of choice for treating hypertension in a patient with diabetes and renal issues? Okay, so patient is hypertensive and the patient is a diabetic and have renal issues, then which is the best antihypertensive to prescribe? That's a question for you. So the options are option number A, beta blockers, option number B, ACE inhibitors, option number C, diuretics, and option number D, calcium channel blockers. So the key points that you have to keep in mind in this question is the patient is diabetic and have renal issues. Okay, so the particular antihypertensive drug should not be nephrotoxic. That is the main thing that you have to see in this question. And so just see the answer first. So the answer for this question is option number B, that is the ACE inhibitors. So why the other drugs are not advisable for patients with diabetic and renal issues? So first of all, the patients with a history of either diabetes or kidney disease should be given an ACE inhibitor as the drug of first choice to prevent the development of or further progression of kidney diseases. Okay, so there will not be any harm to the kidney with this ACE inhibitor. So that's why it is recommended for diabetic and kidney disease patients with hypertension. Okay, so the ACE inhibitors, it effectively reduces the systemic vascular resistance in patients with hypertension, heart failure, or chronic renal disease. And this antihypertensive efficacy probably accounts for an important part of their long-term renoprotective effects in patients with diabetic and non-diabetic renal diseases. Okay, so this is highly which are nephro-renoprotective drug, and it can be used for a long-term basis also. So that's why ACE inhibitors are recommended for patients with diabetic and non-diabetic renal diseases. Okay, so why the beta blockers cannot be used? So theoretically, the beta blockers may reduce the cardiac output, and subsequently there will be renal perfusion pressure, so that the renal perfusion pressure also will be reduced, and thereby exacerbating the renal dysfunction. So this is beta blockers are not recommended. Then why calcium channel blockers are contraindicated in renal failure? So this is because the glomerular capillaries are the primary site of hypertensive injury in proteinuric nephropathies. So calcium channel blockers impair the renal autoregulation, which protects the glomerular capillaries against the transmission of systemic pressures. Okay, so thereby, so this can also result in the further deterioration of renal failure. So that's why calcium channel blockers are not recommended in renal failure. Then why diuretics are contraindicated? So the use of diuretic agents in patients with impaired renal function carries distinct risk of plasma volume depletion or hypotension and further diminution of the glomerular filtration. So existing electrolyte and acid-base disorders are easily aggravated, and thereby renal functions will become more complicated. Okay, so that's why diuretics are also contraindicated in renal failure. So that is a very important and informative question for you. Now I think we can move on to the next question in this session. That is the sixth question. Another important simple question from the fundamentals. Supine position is also known as dash. So what is another name for supine position? So the options are: option number A, dorsal recumbent; option number B, dorsal decubitus; option number C, kneeling position; and option number D, kidney position. So supine position. Obviously, answer is option number B, that is a dorsal decubitus, not dorsal recumbent. So we will see the differences between these positions with the help of some pictures. So first of all, what is a dorsal decubitus position? So this position causes the extra pressure. Why it is called as decubitus? Because it causes extra pressure on the skin and bony prominences over the occiput, scapulae, elbows, sacrum, coccyx, and heels. That's why the supine position is also known as the dorsal decubitus position, because of the extra pressure on the bony prominent areas. Okay, so this is the difference between the supine position and the dorsal recumbent position. So this is a difference. So the main difference between these two positions is that in the supine position the legs are straight and the pelvis is not observable. Okay, so the legs are straight, but in the dorsal recumbent position the legs are bent. You can see here the knees are flexed and the pelvis is observable. Okay, so this is the difference between dorsal recumbent and dorsal decubitus position. Okay, so I think that is clear for you. Now we will see what is a kneeling position. So this is the kneeling position, and I have included other two position pictures also. So this is a stooping and squatting. So don't be confused between kneeling, squatting, and stooping. Kneeling is defined as to position the body so that one or both knees rest on the floor. So here we can see the both knees are resting on the floor. So that's why this is a kneeling position, this is a squatting position, and this is a stooping position. And the final option was the kidney position. So you can see the picture here. So the kidney position resembles the lateral position, except the patient's abdomen is placed over a lift. So you can see here in the operating table that bends the body to allow easy access to the retroperitoneal space. So there will be easy access to the retroperitoneal space. Okay, and the patient is placed in the lateral position with a lift in the patient's abdominal part. Okay, so that is a kidney position. So when kidney position is used, those things we can refer later. So with this question you are learning about what is the dorsal decubitus, dorsal recumbent, then kneeling, squatting positions, and the kidney position. Okay, so that's all regarding the 6th question. Now I think we can see the 7th question. So this is from the psychology, and the question is an example of non-therapeutic communication technique. So I'll be listing some communication techniques. From this you have to find out the non-therapeutic communication technique. And the options are option number A, validating, option number B, belittling, option number C, reflecting, and option number D, listening. So example of non-therapeutic communication technique. So the answer is option number B, that is belittling. So belittling, it is not a therapeutic communication technique at all. So belittling, it is a language or behavior that literally makes someone feel small, unimportant, inferior, or minimized. Okay, so belittling is not at all a therapeutic communication technique. Then the other options, validation. So what is a validation therapy? So validation therapy, which is developed by the field, which involves the communication with a therapist who accepts the disorientation of the person with dementia and validates his or her feelings. Okay, so in dementia this is very useful, and in this technique the psychologist will validate his or her feelings. So this is a validation therapy. Then next comes the therapeutic reflection. So what is the reflective therapy? Therapeutic reflection. So these are the statements which are used by the psychotherapist to restate, paraphrase, or uncover the therapy client's emotional reactions to situations, thoughts, behaviors, or interpersonal interactions. So that is a therapeutic reflection. Okay, so then next comes the therapeutic listening. What is the listening? So it is an interpersonal confirmation process involving all the senses, in which the therapist attends with empathy to the client's verbal and non-verbal messages to facilitate the understanding, synthesis, and interpretation of the client's situation. So this is also a way of therapeutic communication techniques. Okay, so listening, validating, that we have seen. Then belittling, it is not a therapeutic communication technique. Okay, so I think that's all regarding that question. I think you got the point regarding the various therapeutic communication techniques. Moving on to the next question in the session. So this question is from the psychiatry, and the question is, delirium tremens usually starts how many days after the last drink of alcohol? So you know that delirium tremens, it is one of the complicated withdrawal symptom of alcoholic withdrawal, and the question here is that this delirium tremens symptoms usually starts how many days after the last drink of alcohol? So the options are option number A, 2 to 5 days, option number B, 1 to 2 days, option number C, 6 to 8 days, and option number D, 8 to 10 days. So delirium tremens. So the option number A, 2 to 5 days is the answer for this question. So delirium tremens, it is a rapid onset of confusion usually caused by withdrawal from alcohol. So it is now commonly known to occur as early as 48 hours after the abrupt cessation of alcohol in those with chronic abuse, and can last up to 5 days. That means 48 hours to 5 days. That is 2 to 5 days. So that is the answer. Delirium tremens and the other manifestations of delirium tremens and all, we can refer it later, because one or the other form questions can be asked from this session. Okay, so we'll move on to the 9th question in this series. So the question is, which of the following type of insulin is prescribed for a client with diabetic ketoacidosis? So here the question is regarding the type of insulin which can be used in DKA, and the options are option number A, long acting insulin, option number B, Lent insulin, option number C, human regular insulin, and option number D, human NPH insulin. So you know that diabetic ketoacidosis, it is a complication of diabetes. So just think about diabetic ketoacidosis and answer the question. So the answer for this question is option number C, that is a human regular insulin. So why human regular insulin for diabetic ketoacidosis? So regular insulin, also known as a neutral insulin and soluble insulin, it is a type of short-acting medical insulin, and it is used to treat type 1 diabetes, type 2 diabetes, gestational diabetes, and complications of diabetes such as diabetic ketoacidosis and hyperosmolar hyperglycemic states. Okay, so it is a short acting, that's the main thing. uh, why this is used as a treatment options for the diabetic ketoacidosis, and it can be given even IV also. Okay, so lent insulin, also called as the insulin zinc suspension, it is an intermediate duration insulin that is no longer used in humans. Okay, that is a lent insulin. Then next comes the NPH, otherwise known as the neutral protamine hagidone insulin, also known as the isophene insulin. It is an intermediate, again intermediate acting insulin. Onset of effect is typically in 90 minutes and they last for 24 hours. That is intermediate acting. Okay, so I think that is clear for you. Now we can see the 10th question from community health nursing, and the question is the denominator used to calculate effective literacy rate of Indian population is dash. So you should understand what is the effective literacy rate formula, then only you can answer this question. So the options for you are option number A, population aged 18 years or more. Option number B, population aged 7 years or more. Option number C, school going population. And option number D, total mid-year population. So literacy, effective literacy rate. What is the answer? So the answer is option number B, that is population aged 7 years or more. Okay, so we know that the literacy rate, also called as the effective literacy rate, it is the total percentage of the population of an area at a particular time aged 7 years or above who can read and write with understanding. Okay, so this is the definition for the effective literacy rate. So here the denominator is the population aged 7 years or more. So in formula wise we can display it like effective literacy rate equals number of literate people aged 7 or above divided by the population aged 7 and above into 100. Okay, so this is the effective literacy rate. So you should find out which state is having the highest literacy rate, which state having the lowest literacy rate. Those things you can refer later, that can also be asked. Okay, so one more information I can pass to you. What is a crude literacy rate? Crude literacy rate is the total percentage of the people of an area at a particular time who can read and write with understanding, taking the total population of the area, that is including below 7 years of age also as the denominator. So this is the difference. Crude literacy rate means there is no such age bar, but in the effective literacy rate, that is 7 years or above. Okay, that one denominator is there. So that is the difference. Okay, so that's all regarding the effective literacy rate and the crude literacy rate. And crude literacy rate, that the formula is the number of literate persons divided by the total population into 100. Okay, so this is the crude literacy rate. So that's all regarding that question. Now we will see the next question in our series, that is the 11th question from the orthopedics. Deformity of dash bone results in Springle's shoulder. So Springle's shoulder is associated with the deformity of which bone? Options are option number A, scapula, option number B, radius, option number C, ulna, and option number D, tibia. So which can result in Springle's shoulder? So the answer is option number A, scapula. Okay, option number A, scapula results in the Springle's shoulder, and you can see the picture of a baby, of a child with a Springle's shoulder. So we can, from the picture itself, it is self-definable. So it is a congenital elevation of the scapula, or the Springle's shoulder is an anomaly of the shoulder girdle that is associated with the abnormal descent and altered position and anatomy of the scapula. Okay, so abnormal descent will be there, and there will be altered position of the scapula. That is a Springle's shoulder. Okay, so I think that also clear for you. Now we can move on to the 12th question in our series. So this is again from the nursing education. Which of the following is an autocratic method of teaching? Okay, an easy question. Autocratic method of teaching. Options are option number A, lecture, option number B, tutorial, option number C, demonstration, and option number D, independent study. So among this, which is an autocratic method of teaching? So the answer is obviously option number A, that is the lecture method. So autocratic teaching, it is a traditional style of teaching, and these are the teacher centered. Okay, so autocratic means it will be teacher centered or content centered. In this method, the teacher has the full control over the students and teaching, and here the teacher is more active and the learners are passive listeners. Okay, so that's why it is known as the autocratic method of teaching. So the other methods of teaching are not an autocratic method. Okay, so moving on to the 13th question in our series. So the question from the gastrointestinal system: the primary phase in the regulation of gastric secretion and motility is called dash. The primary phase in the regulation of gastric secretion and motility is called dash. So there are several phases for the gastric acid secretion. So here the question is regarding the primary phase in the gastric acid secretion. So the options are option number A, the swallowing phase; option number B, the gastric phase; option number C, the cephalic phase; and option number D, the intestinal phase. So the answer is option number C, that is a cephalic phase. Okay, so we will have a small explanation regarding this question. Gastric activity involved in digestion is divided into three phases of digestion, which is known as the cephalic phase, the gastric phase, and the intestinal phase. So the first phase is the cephalic, then comes the gastric, then comes the intestinal phase. So what all things are happening in these phases, we will see. The cephalic phase of digestion is the stage in which the stomach responds to the mere sight, smell, taste, or thought of the food. Okay, so even the thought of the food can stimulate the process of the cephalic phase, and about 20% of the total acid secretion occurs before the food enters the stomach. So before it enters the stomach, the 20% of the total acid secretion starts occurring. Okay, so that is the cephalic phase. Then comes the gastric phase. So 50 to 60% of the total gastric acid secretion occurs during this phase, and the gastric phase is a period in which the swallowed food and the semi-digested proteins activate the gastric activity. That means the peptides and amino acids. So there are several pathways that we have to study in these phases. I am not going in depth in that, because the hormonal activations and the gastric acid secretion, from where it is secreted, all those things, this physiology is very important, that you can refer later. I am just giving a peripheral just an outline of the phases of gastric acid secretion. Okay, so that is a gastric phase, and next comes the intestinal phase, and in this the 5 to 10% of gastric acid secretion occurs during this phase. And the intestinal phase is a stage in which the duodenum responds to the arriving chyme and moderates the gastric activity through hormones and nervous reflexes. Okay, so these are the three phases, that is the cephalic, the gastric, and the intestinal phase. Okay, in detail you have to study this and you can refer it later. Okay, so that's all regarding that question. Now we will move on to the second last question in our series, and this is from the OBG, and the question is: most common cause of postpartum hemorrhage is dash. So the most common cause of postpartum hemorrhage, or the PPH. So the options are option number A, bleeding disorders; option number B, abruptio placentae; option number C, placenta previa; and option number D, atonic uterus. So which is the most common cause of PPH? All the options what I have given here are some or the other causes of PPH, but here the question is regarding the most common. So the answer is option number D, that is atonic uterus. So you know that atony of the uterus, also called as a uterine atony, it is a serious condition that occurs after childbirth, and it occurs when the uterus fails to contract after the delivery of the baby, and can lead to a potentially life-threatening condition known as the postpartum hemorrhage. Okay, so that is a uterine atony, inability of the uterus to contract or come back to the involution won't happen. Okay, so that is the atony. So next, the last question in our series, that is a picture-based question, and the task is to identify the comfort device what I have shown in the picture in the screen right now. So I have given you a picture of a patient lying on a comfort device. So you have to find out what is that comfort device which is displayed in the pink color. Okay. So what is the answer? So the options are option number A, bed cradle, option number B, bed board, option number C, trochanter roll, and option number D, knee roll. So all the options what I have given are comfort devices. So you should identify the device what I have shown in the picture. So answer is option number C, that is a trochanter roll. Trochanter roll. So see the trochanter roll you can see in the picture right now. So the trochanter roll, it is a safety device that helps to support the hips and the legs so that the femur does not rotate outward. Okay, so the femur does not rotate outward. That is a to keep the femur in the position. That is a function of this trochanter roll, and the other uses and in which all cases this trochanter roll is used that you can refer later. Then next option was regarding the bed cradle. So you can see the picture of the bed cradle here. So a bed cradle is a frame that is installed at the foot of the bed to keep the sheets or the blankets off legs or the feet. So this helps with the air circulation, sensitive skin, and keeping the skin dry, especially if the patient is lying in the bed for long periods of time. So this is the bed cradle. Then what is a bed board? So a bed board is a large flagged board that you put under the mattress to make the mattress firmer. Okay, so it is different from the CPR board, but even the bed board also can be used for the CPR purpose. So it also keeps the mattresses from sagging. A bed board is usually made up of a solid piece of wood or wood slates inside a canvas cover. Okay, so that is a bed board. And the last option was the knee rest. So you can see the picture of knee rest here. So this sturdy foam knee rest is used to aid in positioning a patient's limb for casting and to provide additional patient comfort during the casting process. Okay, so this is a knee rest. Okay. So from this question you are getting information regarding the 4 important comfort devices with the help of the pictures. I think you got the point. So with that we are coming to the end of this series and this session, and we have explained about nearly 15 very important questions, and these questions are some peripheral questions, and there are so much things that you have to read in depth regarding these 15 questions. Okay, so I believe that these questions will help you in preparing for your upcoming nursing officer exams. So thank you for watching the video till the end, and I request everyone kindly keep in touch with us so that you will be notified when the next video will be launched. So till that time, just signing out. Thank you once again.